Representative Morris.
Motion.
Motion's in order.
Mr. Chairman, I would move we would return the bill to sponsor.
It's been moved to return a bill to sponsor. Is there any discussion of the motion? Is there further questions? Is there any? Representative Chu.
Mr. Chair, I'd like to entertain another motion.
Motion's always in order.
Okay. I think this is an important bill that's brought before us today. We have, 100,000 people through no fault of their own fall into a health care cap where they don't qualify for a subsidy and can't get coverage through the exchange that our state's developing. And unlike someone that might make $1 more than they do, they're under the amount. So to allow them to for that gap to be filled, it lies within the legislature. And I believe we have a moral obligation to not leave them out in the cold. I'd love to see this thing printed so we can have further discussion of this. I love the fact that this allows for the personal responsibility that we all want to see that our citizens use as they move forward to seek their own health care. So with that, I would move that we introduce this bill. And this bill number is RS 22506.
Thank you, Representative Chu. So we have a substitute motion to introduce RS 22506. Discussion of either motion or further questions of Representative Rushi. Representative Perry.
Thank you, Mr. Chairman. Although this is a painful discussion, I think, and I can certainly understand everybody's position here, I'm going to just make a comment and vote for the original motion and send it back. Because although the data is suggesting that that's where we go, we're not real happy with the current way that we deliver Medicaid. And I'd like to have some additional time in the interim to actually revamp our delivery system of Medicaid. And then when we do make an option and discuss bringing on new populations, that we do it correctly. So I would vote for the original motion and we go ahead and postpone.
Representative Hickson.
Mr. Chairman, I also want to state that I'll be voting for the original motion to return the bill to sponsor, and the reason I will be voting to do such is the simple fact, I agree with what Representative Perry just said, the delivery system of the Medicaid population that we have currently is broken. It needs updates, and in my mind, this is a very simple formula that we are, and Representative Rushi touched on this earlier, but we are borrowing 43 cents out of every dollar we spend at a federal level. If we move to expand Medicaid, we're borrowing money to expand a broken program. I will not support the motion until the Medicaid program is redesigned for all Medicaid recipients. So,
Mr. Chairman,
Representative Rushi.
if I could respond to that.
Sure.
I believe there is some misconception that with the statement that Medicaid is broken. Medicaid provides services for the disabled and the aged, and it also provides coverage for the poor at a rate that is significantly less than any other payer. It's less than Medicare, it's less than any commercial amount. Could it be improved? Sure. Well, everybody knows the whole healthcare system needs to be improved. But I strongly disagree with the statement that Medicaid is broken. I think the healthcare system is broken. And, Mr. Chairman, I think that continuing to have large numbers of uninsureds helps persist in that broken state.
Thank you, Representative. Any further comments? Representative Chu.
Thank you, Mr. Chair. We have the time to be able to listen to this. I hear that there's been significant data that's presented with regard to this, Millman and the Levitt. It'd be nice for us to hear this and to have a healthy debate this year on it. Also, in addition, if you look at the bill, it looks specifically at redesigning it so that we have the things that we're looking at, the things that we're concerned about. It allows for the department to get those fixes in there. You saw in there that the way that it's written, that allows us for that responsibility of our people. And we can be able to show that fiscal responsibility that such a move would bring us. So with that, I'll be voting no against the original motion, and I'm going to still support and not withdraw my second one.
That's fine, Representative. Wouldn't expect you to do anything different. Representative Hickson.
You know, Representative Rushi, you make some very valid points up there at that podium today, and I applaud your effort. I really do. I think the healthcare system is broken. I agree with you 100%. And, you know, it is not fair, in my mind, that these people that are between $80,000 and $100,000, between the population of 80 and 100,000 in Idaho, fall into that gap coverage. But I will also remind you that comes from a policy from a president that this state did not want. And this administration has put this forward. You know, we were the first ones to come out on board and sue against the federal government in light of this. I just want to remind you of that when we talk about discussing Medicaid expansion. When it was brought before the Supreme Court, Chief Justice Roberts said, plain as day, you know, you guys are states, you need to start acting like it. He was talking about the Medicaid expansion portion. I know that healthcare needs to be fixed. I agree with that 100%. I'm working on legislation to further that effort, and Representative Rushi, I know you are too. I just don't feel like expanding Medicaid at this point in time is going to do that trick.
Okay, gentlemen. It's getting pretty close to time to vote. Representative?
I would just point out that those same uninsured that we're trying to cover now with a bill that did pass within the past 6 years, those were uninsured prior to that period, as well as several million more in America. So I think that I understand what you're saying, but I don't believe that the lives and the health of the Idaho citizens is a political issue.
Okay, any further comments? The chair would have the following comment, if you'll indulge me. Representative, thanks for bringing this. I appreciate that. The rules are that if a committee member is presenting, you have to stay at the podium until after the vote is taken, and then you can return to your seat. So all of us need to remember that as we present bills coming up, that committee members cannot return to their chair until the vote is taken. So just as a reminder to everyone. We do have a real issue with indigent health care in the state of Idaho. We do not have a good situation at this point in time. We have a very inefficient system and a very high-cost system that essentially doesn't deliver much health care to our indigent population at all. And that is simply not right, and it's simply not good. However, I do think that at this point in time, the state is not ready to move forward with this. The governor had a Medicaid working group, and that working group came up with the following statement, that the group would not support just an enlargement of an entitlement program. What we wanted was a redesign of Medicaid to a different type of a system. We didn't know what that was exactly. We wanted more self-responsibility in the system, understanding, of course, what self-responsibility means to the disabled population and the mentally ill population, et cetera. That's a whole different concept than responsibility into a normal, healthy adult. At this point in time, I don't think we're ready to go there. Now, we do have to do something. Saying no is not an acceptable answer, and we have to do something as soon as we can. However, there are options out there that I think the state can look at that will get us down the road of where we need to go and accomplish a redesign and finding an Idaho solution to Idaho's indigent healthcare problem. It's not going to be fast enough for a lot of us in this room, but that's what we're going to have to accept. Now, in about 2 or 3 weeks, the Director of the Department of Health and Welfare, Dick Armstrong, has about an hour presentation on the efforts around the United States to move into privatization models of Medicaid. And I've scheduled, or will schedule that, in the Lincoln Auditorium so that that can be broadcast around the entire state of Idaho. So we can see what efforts are undergoing and how we might get there in the real near future in Idaho. So that's where I think we need to go. And without further ado, I'll be supporting the original motion. There being no further comments, are there any further motions? We will first take up the substitute motion, which is to introduce RS 22506. All those in favor of the motion say aye.
Mr. Chairman,
Representative Hickson?
I'd like to request a roll call vote, please, for both motions.
Roll call vote has been requested. We'll ask the secretary to call the roll when she is ready to do so. This is on the substitute motion.
Representative Perry?
I go first.
Oh, I had yours last. I had yours last. No. Okay. Representative Wood?
No.
Representative Perry?
No.
Representative Hansey? No. Representative Henderson?
No.
Representative Hickson?
No.
Representative Malik?
No.
Representative Morse?
No.
Representative Romrell? Representative Vanderwoude?
No.
Representative Chu?
And Representative Rushi?
Representative Rushi?
Aye.
Sorry.
The vote is 9-2. The motion fails. We will now take up the original motion. We'll ask the secretary to call the roll on the original motion.
Chairman Wood?
Aye.
Representative Perry?
Yes.
Representative Hansey? Representative Henderson?
Yes.
Representative Hickson?
Aye.
Representative Malik? Representative Morse?
Yes.
Representative Romrell?
Yes.
Representative Vanderwoude?
Yes.
Representative Rushi?
No.
Representative Chu?
No.
On a 9-2 vote, the motion passes, and RS 22506 will be returned to the sponsor. Thank you, Representative, for your presentation. Committee, that is all we have before the committee today. The committee will stand adjourned.